It's 4 o'clock and it's our special edition of AirSculpt TV. Today's Wednesday. I'd like to start by going over our 5-day before and after results from our kink cure procedure that we did in Nashville last week. So what I'm going to show you, what's behind my head, are the 5-day after photos for Sarah's ankles. So she had what some people call cankles, and we have a new procedure called the kink cure. We did it on her. We want to show you, these aren't even 1 week after photos. These are 5-day after photos. In 2 months from now, she'll look wildly different. But what I want to show is she already has a very appreciable change. She's extremely happy. She's more happy than we are, honestly, because she doesn't realize how good she's going to look. So this is something that's really bothered her for a long time. And so many of our patients have no idea this is possible. So we just want to show you a little sneak peek, and we're going to show more of her results as time goes on and she has some time to heal. But for 5 days, it doesn't get any better than this. So just want to show you, you can see really nice contour here. You can see how it curves in like this. Instead of just a straight line down, now she has an ankle. And that was achieved with AirSculpt in the kink cure. So, and you can see how this beautiful curve here. And we're going to show more pictures, and we're going to show you as she heals. But so few people realize that if your ankles bother you, that this is possible. Not only possible, but 5 days later, to have a big change. And you'll see there's some bruising there. And I want to talk about that for a second. Any place that's the lowest part of gravity for an area, no matter what area you do, if you have an AirSculpt done, or frankly, almost any procedure, if you're going to have bruising, it's going to go to the lowest point of gravity. In this case, her ankles are bruised, not bad, not terribly bruised, but they're going to improve very, very rapidly. So our next AirSculpt TV episode, we're going to give you a follow-up picture so you can see that the bruising is gone, and you can see that her ankle definition is even better. But in 3 months, I'm expecting a absolutely superb result. But for 5 days, I couldn't be any happier than I am. So I wanted to show you that, and that was done in Nashville. And we want to thank Sarah again for sharing her kink cure experience with us. Backed by popular demand, we're going to be doing another Power BBL today. We're doing it in Beverly Hills. We had a lot of requests for Beverly Hills, so we're going to go to our beautiful office there on Bedford in Beverly Hills, where Elite started out, and we're going to do a Power BBL and have you watch the procedure, ask questions. If you have questions, Lauren's reading, and she can ask the patient directly, and we'll go to Beverly Hills now. Hello.
Hi, Dr. Rollins.
Hi, nice to see you. How you doing?
I'm doing well. How are you?
Great, thank you. So we're live in Beverly Hills, huh?
Yes, we are in Beverly Hills, and we have a very special patient here, Jessica.
Okay, what is Jessica?
Yeah, let me introduce you.
Hi, Dr. Rollins. Thank you
Hi,
for having
Jessica.
me.
Very nice to meet you. Thank you so much for doing this with us.
Of course, of course.
I'm so excited for your transformation. How has AirSculpt been so far?
It's been amazing, super comfortable. The staff, the doctors, the nurses, everybody has made me feel so calm and relaxed. So I love it.
Thank you. Was it weird to see your fat leaving your body?
I was so excited to see it leave my body. It looked so cool. I gained a little bit of weight during quarantine, of course, as everybody else did. So seeing it leave was just such a huge relief to see it be gone from like all my stubborn areas. So I was super excited.
Well, and you want to watch the fat go now into your butt to recreate that contour that you want?
Yes, yes. So I've always been really insecure about my butt and my hip dips. And I was kind of just looking at different options. And I had a friend that actually went to Mexico to get a traditional BBL. And I, at one point, was considering that. But then once I saw her recovery, it completely terrified me. Her recovery was just really hard, and she was so swollen, and she had all these like tubes coming out of her, and that just freaked me out. So once I found Elite and I learned about AirSculpt and all of that, like it really just kind of changed my mind. And I was like, this is something that I prefer to do, because just the recovery time is so much easier.
Well, not only will the recovery time be basically nothing, I'm telling you right now that tomorrow you're getting a BBL and tomorrow you can go back to work. You know,
Yeah,
you can do
yeah. So
pretty much
that's
whatever you
one
want
of
tomorrow.
the big benefits. Yeah.
And as you've seen, there's no needle, no scalpel, no stitches, no drains. You're awake. You can actually be a participant in your procedure and be involved, you know?
Yeah.
And that's really, really important because this is your body and we're custom making this result for you and what you want and need. So there's nothing similar about this to getting a procedure done, for example, in Mexico or overseas, or frankly, any non-AirSculpt powered BBL. There's nothing similar. So a couple other questions before we start. Did you have any special music that you listened to?
Yes, we've been listening to a lot of Cardi B and a lot of Megan Thee
Very,
Stallion.
very good BBL music.
Yes, we're trying to keep it in theme, so we want to stick to some Cardi B and Megan Thee Stallion.
Oh, I couldn't agree more. So I like that. I just learned about her, and I think it's perfect BBL music. Yeah, like,
Yes.
you're living the lifestyle. I like that.
Yes.
So, and how is Dr. Konevsky treated?
Dr. Konevsky has been so amazing. He's been walking me step by step through everything, which I prefer. I just like to know everything that's happening, and he's been so amazing. He's made me feel extremely comfortable, and he's definitely making sure that I'm getting exactly what I want.
Well, he went to the same medical school as me, so he and I are brothers from another mother. So, without further ado, Dr. K, do you want to start the Power BBL?
Yeah, sure. Hey, Dr. Rollins. Hi, everybody who's watching. Welcome to Beverly Hills, California. We're happy to see you during the holiday times. And so, yeah, Jessica's been an incredible patient so far, super helpful in kind of detailing exactly what she's looking for. And that kind of relationship is great just to make sure that we can get the results that we want. So what we've done so far is we've actually completed one side.
We've done one side already. Well, let's compare side to side.
Yeah, sure. So we've put 1.2 liters on the right side of pure fat. So if you back up just a little.
Oh, wow. Wait, how much did you put on that side?
Almost 1.2 liters. Yeah. So
1.2 liters, everyone watching. So we're doing serious Power BBL here. This is no joke.
Yeah, so Jessica was telling us, her biggest area of concern is this hip dip, and the hip dip is an area that's really, really common and one of the best areas to be putting fat, because you can really create that beautiful contour to create that sort of upside down shaped heart for the bottom. So for the butt here, we filled in the hip dips completely, and you can actually compare. If you look from the top, you'll see that this is the side that's filled in, but if you look from the top, if you stand up right there and give us a little bit of a top view, I'll show you a little bit higher up.
Oh, what a great difference. Okay, can everyone see the difference between her left cheek, the one on the bottom, and her right cheek? I mean,
so this is the side that's been filled right here, and you can see this.
That is beautiful. This is
really
beautiful.
Yeah, we still have quite a bit more work and filling to do on this side.
Before you start, would you just show her incision around, at the bottom part of her butt? I want everyone to see. Everyone asked about the incision. Would you just show that incision?
Yeah, you might need a microscope to see it. It's pretty small.
Okay, there we go.
Yeah, it's really small. So
that's what we're talking about here. This is all done through 2-millimeter holes, which is the size of your average freckle. And some people who scar dark, big deal, you have a new freckle. I mean, that's what we're talking about here. This magnificent change is done through that. And again, no drains. Obviously, she's wide awake. Jessica, how did it feel when he was injecting the fat in your butt?
I didn't feel anything. I mean, I feel absolutely no pain. I'm completely comfortable. So I mean, it's great. And like I said, Dr. Konevsky has been walking me through every step. So I really don't feel anything right now.
I love your result. Like, wow.
Thank you. I'm excited to see it.
Have you seen it yet?
No, not yet, but I can't wait.
Okay, guys, you can give her a rear view mirror. I love a rear view mirror because you could just see it yourself. No biggie. So, and then we'll show Dr. K working on your other cheek. But guys, give her the rear view mirror so she can see a sneak peek. So just look back.
Oh my God, look at that.
You're going to be recruited for one of those Megan Thee
Look
Stallion
at
videos.
that. That looks amazing.
Oh, it's
That's
beautiful.
exactly what I wanted.
Good. Oh, perfect. I'm so happy. Okay, let's watch Dr. K do the Power BBL. So if you can just show him, and everyone, whenever you hear a beeping noise, that means the Power BBL pump is laying out fat through a special tube. There's no syringe. Okay, he presses a button, and you'll hear a beep, and all that's happening is that means that's his way of knowing fat's going. I don't hear the beep.
Oh, let's turn the volume back up on the beeping. There we go.
There it is. That's the Power BBL chirp.
Amazing.
So everybody, what he's doing is he's feathering the fat in very carefully to create a natural, symmetrical Power BBL. He's doing the exact same thing to the right side as you do to the left. Dr. K, are you going to put in 1.2 liters on this side, you think?
Yeah, we're gonna make it match and give Jessica the proportional shape that she's been asking.
Oh, that's wonderful. I'm so happy for you, Jessica.
Thank you.
And let's show the fat actually. Let's show the fat going in the pump. Would you pan over to the fat?
Yeah, right there.
Yeah, so that's her fat, and it's getting pumped from a sterile container that was treated with antibiotics, and it's just going through our BBL system and through a special tube into her butt. And we'll talk more about where the fat's actually going to keep it safe, make sure it lasts, and give you a natural result. This is not going into her muscle. This is actually going into her fat plane. This is going into between her skin and her muscle is a fat layer, and we're just inflating that fat layer. I call it the Oreo cookie model. We're just going in the creamy center. So let's see if we can watch her butt actually grow. So pan back to Dr. K, and let's just take a good look at her right cheek and see if we can watch it grow.
All right, so you can already come around to this side. You might see a little bit better. We're going to show you.
Yeah, go from there. Perfect. Okay. Yeah, let's watch the side.
So what we're doing right now is we're filling in the hip dip.
Beautiful.
A little closer.
That is disappearing before our eyes.
Hip dips is one of my favorite areas to fill in just because I can see the transformation happen like live while we're doing it, and it makes such a difference from all angles for the patient, from the front, from behind, from the side.
Beautiful, beautiful work. Well, Jessica, you are going to have such a great result. So everyone, we are going to, on the next episode of AirSculpt TV, we will show you her some pictures so you can see what a great result she has and what a small waist I'm sure she has already. We're going to go back to our question and answer session. If anyone has any questions that you want to ask Jessica, you could tell us now. Lauren, do you see any questions?
All right, awesome.
All right.
Yeah, do you have some questions for Jessica?
Anybody? Okay, I guess not. We're going to go back to our regular question and answer session. Jessica, we are honored to have you with us, and thank you so much for sharing your experience with us.
Bye, Dr. Rollins.
You're a real sport, so we can't thank you enough. And now anyone who goes
Thank
live
you
with
so
us,
much.
we're going to send you a special AirSculpt sweatshirt that we have for patients who are kind enough to share their experience.
Oh,
So
thank you. I
get
appreciate
one of the
that.
first ones. They're really cool. So
Thank you.
yeah. But thank you, and I can't wait to see your result.
Okay.
So we'll see it soon. Thank you.
Thank you. Nice
Take care.
meeting you. Bye.
Meeting you too. Okay. So we're going to answer some very common Power BBL questions. Lauren, go ahead.
All right. What is the typical time frame that this procedure takes?
The typical Power BBL takes an hour and a half to 2 hours, but the actual BBL part maybe takes 20 minutes, 30 minutes at the most. It's really the AirSculpt that takes harvesting the fat, preparing the fat. Using AirSculpt takes more time depending on how many areas are getting done. So another question that we just were asked was, how is a Power BBL different than butt implants? We get that question a lot, and it's a very important question because there is nothing in any way similar between a Power BBL and butt implants. It's very rare to get butt implants anymore. Pretty much everyone gets fat unless you have no fat. But in my opinion, butt implants are not the way to go. No matter who you get a BBL from, I suggest not getting butt implants because they can extrude, which means actually erode through your skin. They can move around. They have a lot of problems. If butt implants were a good thing, then Power BBLs wouldn't exist. So it's actually getting a real implant, like a breast implant, but just for your butt. So not recommended and very invasive. This is as minimally invasive as these results can come.
Someone asked, can I sit down after a Power BBL?
Yes, so can you sit down after a Power BBL? You sure can. You do have to sit on a special Power BBL pillow, but you can sit down the following day, absolutely, and every day thereafter.
What areas are fat harvested from to transfer to the BBL?
So you can harvest fat from any area in the body, any area of unwanted fat you have can be transferred to your butt in a Power BBL. It could be your inner thigh fat, tummy fat, waist fat, or all of the above. It could be arm fat. Chin fat wouldn't have enough fat to make it worthwhile, but it could be done.
Right. How much fat is needed for a Power BBL?
Great question. We always get this, how much fat do I need for a Power BBL? It depends on what you want. What's great is we did a Power BBL a few weeks ago, and we only did around 200 or 250 cc's. Patient was very happy. Everyone loved her results. One of my favorites, actually. She had a smaller butt and just wanted kind of more lateral roundness. And that's all it took. On the other hand, our patient Jessica today is getting 1.2 liters. It's a liter more than the last patient, but she wanted a different result. She wanted more projection, more roundness, more fullness, and she started out with kind of a flat butt. So it really depends on what your needs are. There is no number.
All right. Can you make the buttocks wider?
So can we make the buttocks wider? Yes. Part of Jessica's result today is actually making it wider, which means rounder, really.
All right. Can I target my tailbone and also transfer fat during one session?
I'd love to talk about tailbone for a second. So a lot of people ask about tailbone. Part of the Power BBL is actually having your sacrum or tailbone done. They mean the same thing. It gives you a nice scoop out so you get more of a buoy pop effect. That indent here in your lower back is really part of the procedure and it just gives you a very feminine, curvy look. And it's part of the procedure.
All right. What affects the survival rate of grafted fat?
So everyone asks, how much of the fat you put in is going to last? It depends on the patient, and it depends on if you follow the instructions, but approximately 65 to 70% of what we put in will last. Now, what that means is we purposely put in about 20%, 25% more fat than you really need because we overfill so it shrinks to be the right size. So at first, anything we do a fat transfer on, whether it's your breast or your butt or any area where we transfer fat, we purposely put too much knowing that we're going to get some shrinkage. So it's really not an issue.
What types of scars can I expect?
The types of scars you can expect is exactly what you saw today. It's a 2 millimeter dot. Most people actually end up with no scar. Some people scar dark. If you scar dark, you might have a dark spot there. It can be treated with laser or bleaching cream, but of all the many thousands of procedures we do, it's a very rare issue.
If my butt is uneven, can we transfer to just one butt cheek if necessary?
So some people feel like they want enhanced symmetry, whether it's with their breast or their butt. And yes, we could just do one side of your breast or your butt, or work on both sides, but then try to give you more symmetry. So maybe we add more fat to one side and less fat to another.
All right. There are no BMI requirements, correct?
There are never any BMI requirements at Elite. So we do any BMI, whether it's 18 or 40, it doesn't matter. We don't believe in that number. It's not relevant to what we're doing.
And then last but not least, someone's asking what the aftercare for Power BBL is.
The aftercare for a Power BBL really is to live your life. We want everyone with any AirSculpt procedure to walk at least 45 minutes a day. That helps prevent complications. It also helps you heal. It keeps your blood pumping. But there really is nothing to do. You wear a garment, a special Power BBL garment. You only have to wear that for between 2 and 3 weeks, depending on what your surgeon says. And that's it. It's like any other procedure at Elite.
Awesome. I think that's about it.
Any other questions that anyone wants answered?
Let's see. What pain medications are given?
So for pain, I mean, we're talking about a major transformation here, as you can see. She's getting a very serious Power BBL. She's only going to get ibuprofen. Ibuprofen 800 is what we use for pain. We use no narcotics. We don't believe in them. We don't send people in with narcotics. And unless it's by special request and there's a good reason why, ibuprofen 800 just takes care of people. They're not in that much pain. It's really more of a soreness than a surgical pain.
Someone is asking if we do ankles.
Do we do ankles? We sure do. So I help people get really interested in the Cancure, our procedure to help contour your ankles. It's my new favorite thing, and I'm really excited about it. I love this result for 5 days behind me, and so many patients are unhappy with their ankles, and we can help.
Awesome. Let's see. Can you guys do a 48-hour six-pack?
We sure can. We can do a 48-hour six-pack. It's one of our first procedures at Elite.
Okay.
Well, that's it. So thank you so much for watching. It's been a pleasure. And happy holidays to everybody. And I can't wait to see you soon. So enjoy the holiday.